So at this point, I would like to invite Professor Milner to come up and make a few remarks, if you would like. You're going to need to be near the microphone because of the live stream. Can you stand me? Is that okay?
Well, then I'm not visible, but that's okay.
I think you're still visible.
You think I'm still visible? Enough of me. Anyway, Leslie, colleagues, friends, distinguished colleagues, for me, I'm a little overwhelmed. I'm very rarely at a loss for words, as I think those of you who know me realize. But tous ces éloges, you know, one after the other, je ne me reconnais plus. I am, I think, proud of having brought psychology and neurology and neurosurgery much closer, you know. As I think somebody mentioned earlier, I was told by my supervisor, Donald Head, that no psychologist could survive for long at the Montreal Neurological Institute. You know, that it was essentially a medical stronghold, that that Penfield really welcomed people for a short time to do an interesting piece of research on his patients. But after, you know, you went your way. And somehow I found this environment so enticing. I was very happy teaching at l'Université de Montréal. I crossed this mountain. I always loved French, and it's l'Université de Montréal qui m'a accepté, qui m'a accueilli. C'est pas l'Université McGill. Quand je suis venue ici, je suis très reconnaissante à l'Université de Montréal. But the temptation, I would come Sunday afternoons to test the patients. It was this terrible guess. I had Lamar Roberts, the chief resident, would try to guess who was going to be operated on. I mean, this sounds strange now because our seizure patients now are studied for weeks and weeks, and whether this patient should really be operated on or not is an enormous debate. I know it goes on like this, but in those days we would have 3 patients seen in an hour, and Dr. Penfield would decide he was going to operate on 2 of them next week. And then I had to, because I wanted a preoperative baseline, I had to guess which one was going to have this operation. And the trouble was that they all had a pneumogram, which gave them terrible headaches. They lay flat on the bed. And as soon as I got there and wanted them to sit up and do blood design or something, they got this terrible headache. And so I battled to sort of find my way between the pneumogram and the surgery and guessing which patient it was going to be and working the other side of the mountain. It was quite challenging and exciting, but obviously I thought it was very well worthwhile, and it certainly was, and I found it's incredibly rewarding today. The compliments sont un peu exagérés, il faut dire, but not to the business of getting. I think what I'm proudest of is getting cognitive, I call it behavioral neuroscience. I don't call it cognitive neuroscience. Behavior is a broader term. I feel very pleased indeed and proud to have got behavioral neuroscience so firmly established here, and this institute leading the way. I mean, now everybody's doing behavioral neuroscience, but we led the way. And for that, I am enormously grateful to also to the students who have worked with me. And I know many of these students are here today, and I want to thank you all for being here. And just to say that this is, well, it continues to be a wonderful adventure. I'm enjoying every minute of it. And thank you so much.